Welcome to the Hoofcare Companion 5-minute knowledge sessions, short sharp revision tools to help you master equine anatomy with your host Mark Jerram. The equine carpus.
Learning outcomes.
After listening to this podcast, you should be able to describe the anatomical structure of the equine carpus, including the bones and joints that comprise it, explain the function of the carpus during weight bearing and locomotion, recognise the importance of the carpus in maintaining limb stability and identify common clinical conditions affecting this region.
Definition.
The equine carpus, commonly referred to as the knee, is a complex synovial joint located between the radius and the metacarpus of the forelimb. It is composed of multiple small carpal bones arranged in 2 rows, forming a series of articulations that provide strength, flexibility, and shock absorption. Although commonly called the knee, it is anatomically equivalent to the human wrist. The carpus plays a vital role in supporting the horse's body weight, absorbing concussion during locomotion, and allowing controlled flexion of the forelimb. Due to the substantial forces transmitted through this region during athletic activity, the carpus is frequently affected by traumatic injuries and degenerative joint disease.
Origin.
Embryologically, the carpus develops through endochondral ossification, whereby cartilage models are gradually replaced by bone. During fetal development, individual carpal bones form separate centres of ossification before fusing into mature structures. In the adult horse, the carpus forms the articulation between the distal radius proximally and the 3rd metacarpal bone distally, with additional support from the 2nd and 4th metacarpal bones. Numerous ligaments, tendons and joint capsules stabilise the carpus while permitting the controlled movement necessary for efficient locomotion.
Anatomy.
The equine carpus consists of 7 or 8 short bones arranged in 2 rows. The proximal row comprises the radial, intermediate, ulnar and accessory carpal bones. In many horses, the radial and intermediate carpal bones are fused, resulting in a total of 7 carpal bones rather than 8. The accessory carpal bone projects caudally and acts as an important lever arm for the flexor muscles and tendons. The distal row consists of the 1st, occasionally absent, 2nd, 3rd and 4th carpal bones. The 3rd carpal bone is the largest of the distal row and bears a significant proportion of the compressive forces transmitted through the limb. These bones form 3 principal joints: the antebrachiocarpal, radiocarpal joint between the radius and proximal carpal row, the intercarpal joint between the proximal and distal rows, the carpometacarpal joint between the distal carpal bones and metacarpal bones. The antebrachiocarpal and middle carpal joints contribute most of the movement within the carpus, while the carpometacarpal joint has minimal movement and primarily provides stability. The carpus is reinforced by strong medial and lateral collateral ligaments, dorsal and palmar carpal ligaments, and the palmar carpal fibrocartilage, which resists hyperextension. Numerous tendons pass over the carpus, including the common digital extensor tendon dorsally and the superficial and deep digital flexor tendons on the palmar aspect. These tendons are retained close to the bones by extensor and flexor retinacula, preventing bowstringing during movement.
Function.
The primary function of the carpus is to permit controlled flexion while maintaining stability under considerable loading. During a locomotion, it acts as a shock absorber, dissipating forces generated when the hoof contacts the ground. At faster gaits such as the canter and gallop, the carpus undergoes substantial extension during weight bearing before flexing rapidly during the swing phase to allow limb advancement. The carpus also contributes to efficient energy transfer through the limb by coordinating movement between the radius and metacarpus. Its multiple articulations distribute compressive forces across several joints, reducing stress on individual bones and helping protect surrounding soft tissues. For the farrier, maintaining correct hoof balance is essential to minimize uneven loading of the carpus. Poor middulateral or dorsopalmar balance can alter limb biomechanics, increasing stress on the collateral ligaments, carpal joints and associated tendons. Repetitive overloading may contribute to conditions such as osteoarthritis, carpal chip fractures and carpal bone sclerosis, particularly in performance horses. Clinically, the carpus is one of the most frequently injured joints in racehorses and other equine athletes due to the high compressive and shear forces experienced during fast work. Common conditions include osteoarthritis, chip fractures, slab fractures, collateral ligament injuries and septic arthritis. Diagnosis typically involves lameness examination, diagnostic analgesia, and imaging techniques such as radiography, ultrasonography, computed tomography, CT, or magnetic resonance imaging, MRI.
Conclusion.
The equine carpus is a complex synovial joint composed of multiple articulations that provide a balance between mobility and stability. Its unique arrangement of carpal bones, ligaments and tendons enables efficient shock absorption and controlled movement during locomotion, while supporting the considerable forces generated during athletic activity. An understanding of the anatomy and function of the carpus is fundamental for farriers, as correct hoof balance plays a significant role in maintaining carpal health and reducing the risk of injury. Knowledge of this region also assists in recognising lameness, understanding disease processes, and supporting appropriate farriery and veterinary management.
Learning questions.
Pause after each question to allow you time to answer. How many carpal bones are typically present in the equine carpus and how are they arranged? Name the 3 principal joints that make up the equine carpus. What is the primary function of the accessory carpal bone? How does the carpus contribute to shock absorption during locomotion? Why is correct hoof balance important for maintaining the health and function of the equine carpus? Thank you for listening and taking part in the Hoofcare Companion 5-minute knowledge sessions. Visit my website eitherfarrier.co.uk for further educational content.